Welcome to this explainer. Today, we're decoding the academic syllabus of mental health professionals. We're taking what could just be a dry, boring list of job titles from our source material and transforming it into an engaging character guide, a sort of field guide to the experts who heal the mind of Lapuri. So, if you've ever been totally confused about who does what in a complex world of therapy and psychiatry, well, you are definitely in the right place. Okay, let's take a quick look at our roadmap. First, we'll hit on rising modern anxiety, then break down the mental health team. Next, we'll dive into clinical and counseling psychologists, compare psychiatrists and psychoanalysts, check out some specialized roles, and finally wrap up with the collaborative approach. Section 1. Rising modern anxiety, the battleground of the mind. Look, before we meet the actual heroes of our story, we've got to understand the modern battleground they're trained to fight on. Our source material points out that society is currently just getting hammered by a barrage of severe stressors. We're talking fierce competition, rising inflation, widespread unemployment, and this pervasive general anxiety and insecurity. Throw in the dizzying pace of rapid industrial progress, political corruption, and a decline in moral values, and it's literally a perfect storm. All of these things feed directly into increased mental problems. It's not just background noise, It's the exact reason this whole taxonomy of expert exists in the first place. And because of all that, a really fundamental truth emerges from the research. This complex anxiety crisis, it absolutely cannot be fought alone. The mental hurdles generated by our modern world are just so incredibly multifaceted that they require a highly coordinated team of experts. These professionals have to work together or in conjunction with each other in psychiatric centers and hospitals to treat these illnesses. It really takes a unified front. Which brings us to Section 2, the mental health team, professional versus semi-professional. So our roster of healers is clearly split into two distinct tiers of expertise. Right at the top, we've got the professional experts. These are your highly trained specialists armed with advanced degrees. Think clinical psychologists, psychiatrists, and psychoanalysts. But equally important is the second tier, the semi-professional experts. These include folks like group-related mental health workers and addiction counselors who provide vital, highly targeted support for specific community needs. It's really that perfect combo of advanced medical theory and on-the-ground community support that makes the whole system actually work. Moving right along to Section 3, clinical and counseling psychologists, the foundation. First up in our professional tier, let's look at the foundational roles of the field. There is a very distinct academic split between these two paths. On one side, we have the clinical psychologist, which puts a super heavy emphasis on clinical testing and severe psychological disorders. But then on the other side is the counseling psychologist path. Now, these experts focus much more heavily on resolving everyday life hurdles. Stuff like providing guidance for occupational choices, helping students with school problems, or navigating the really messy complexities of marriage. Kind of like leveling up a character in a video game, becoming a clinical psychologist requires a really rigorous training arc. You start at Step 1 with a Master of Arts or Master of Science in Psychology. Step 2, that means advancing to a doctorate. And here's a neat little detail. Earning a PsyD, or Doctor of Psychology, places an even bigger emphasis on practical clinical testing. Finally, at Step 3, before you can even think about practicing, you've got to complete a mandatory internship treating psychological disorders for at least 1 full year. So yeah, it's a massive commitment. But hey, all that training unlocks some pretty cool special abilities. It allows them to step up as specialists in mental hospitals, using unique methods like conversation therapy or even sports therapies to treat patients. But to actually practice as an independent professional, they have to hold the proper guild certification, so to speak. For example, in India, that means getting official permission from the highly respected IACP, the Indian Association of Clinical Psychologists. All right, let's jump into Section 4. Psychiatrists versus psychoanalysts, the great contrast. This is easily the most confusing territory for people trying to learn about mental health fields. But looking at it side by side highlights their core differences, their base stats, if you will. A psychiatrist is fundamentally a medical doctor. They hold an MD in psychiatry or a DPM, and they literally diagnose disorders by physically examining a patient's anatomy and medical symptoms. In stark contrast to that, a psychoanalyst needs either an advanced psychology degree or a medical degree, but their entire practice is focused squarely on the subconscious, deeply rooted in the theories of Dr. Sigmund Freud. So here is the absolute crucial point to remember. Because they are actual medical doctors, only the psychiatrist has the ability to deploy direct medical interventions. If a patient needs prescriptions like tranquilizers, sedatives, injections, or even specialized medical procedures like electric shock therapy or ECT, the psychiatrist is the expert called in to administer that care. and they usually have about 2 to 3 solid years of hospital experience under their belt to do it. On the flip side, the psychoanalyst relies on an entirely different set of tools to heal the mind. We're talking psychological techniques like free association, error analysis, and dream analysis. But honestly, here is the most fascinating detail from our sources. Before a psychoanalyst can independently treat a single patient, they actually have to endure their own personal psychoanalysis. After that, they go through 2 to 5 years of strict training under an expert psychoanalyst. Basically, they have to explore the depths of their own subconscious first before they can help anyone else with theirs. How wild is that? That shifts us nicely over to Section 5, Specialized Roles, Schools and Society. Because, as we know, the battle against mental illness doesn't just happen in traditional clinics and hospitals. It requires highly specialized agents embedded right into our daily lives. 2 great examples of this are school psychologists and psychiatric social workers. The school psychologist specializes in child psychology, which requires a PhD or a PsyD to specifically tackle educational problems right where kids spend most of their time. Meanwhile, the psychiatric social worker comes at mental health from a broader societal angle. Requiring a Master of Social Work or a sociology PhD, they really understand how things like societal structures, complex family dynamics, and community resources impact a patient's overall mental well-being. And that brings us to our final stop, Section 6, the collaborative approach, uniting the roles. Let's see how this massive, diverse taxonomy of experts actually unites to form a cohesive healing force. Building on the foundation of the high-level doctors and psychologists we've been talking about, those semi-professional experts are absolutely vital. Counselors for addiction and group-related mental health workers provide the essential, holistic, community-level care. Think about it. While the psychiatrist might prescribe the medication and the clinical psychologist runs the testing, it's very often the semi-professional expert who's right there on the ground, guiding a community group or supporting someone through the grueling daily reality of addiction recovery. It literally takes the whole team to truly heal the mind. Well, there you have it. We've walked through the entire roster, we've seen how modern stressors create the battlefield, and we've met the amazing professional and semi-professional experts trained to fight on it. Now that you understand their unique training, those intense internships, and their very specific abilities, here's a question I want to leave you with today. With so many incredible, specialized tools available to heal the mind, ranging all the way from Freudian dream analysis to advanced medical prescriptions, which specific expert's approach resonates the most with you? If you were stepping into the ring, which expert would you want in your corner? Think about that for a bit. And as always, keep exploring the fascinating world of the mind.